Thanks, Anna. Welcome again.
Thanks a lot. Thank you, Emek. Thank you, everybody. And I'm waiting for the slide presentation delivered by Materia Prima. It is my great pleasure to have a few words on psychiatric conditions, actually, that are associated with urticaria. I am not a psychiatrist or psychologist, but being a head of psychodermatology department, where I have an interdisciplinary team, so there are biologists, psychologists, there are also psychiatrists. I have 20% of my job on the psychiatry department. And being myself a dermatologist, allergist, and clinical immunologist, I can actually spend more time with our patients. And it's also beautifully said that it's extremely important to be, as I feel and practice on an everyday basis, to be understood and taken care of. Because urticaria has enormous burden on functioning, and actually, such a holistic approach, biopsychosocial, it's urgently needed in our health systems all over the world. May I have the next slide, please? So my presentation plan. I will say a few words on psychological, psychiatric comorbidities and chronic urticaria patients. Emek beautifully said that 1 in 3 patients have some psychiatric problems because the disease is extremely troublesome. People don't function. Everybody who had some urticaria once in life do actually agree with that functioning is extremely disturbed. And actually, not only the patient is suffering, but so-called great patients, according to the proposal of Professor Finlay from Cardiff University. Actually, the whole family and all the people around the patient, support group, really suffer. So I will say also a few words as regards patient-reported outcome measures, which is extremely important for medical health providers. And these tools give us professionals insight of what the patient feels, suffers, needs. Then I will break the presentation with my favorite topic. It means stress. So taking out of the balance and how to cope in today's life. And that stress is actually every day, everywhere, and will be. However, how to cope with that in order not to be put too much out of the balance. Of course, with taking care and stress strategies are coming time issues, because obviously each of us have only 24 hours a day for all our activities. So what to do, how to take care of the patient in a best possible way, and actually help the patient and help ourselves, medical health providers, because we all are on the same boat. And then I will share with you my team personal approach to the patient, being out of psychiatry and psychological departments. Because of legal stuff, we need actually, when the patient is referred to psychiatry, it's always agreement important. And because of stigmatization of psycho issues, still, unfortunately, in today's world, sometimes it's difficult to get actually help and understanding. And as Arthur said, of course, it was she was saying about dermatologist access, but getting to psychiatry or psychological departments, it's also not easy as regard time. But we have the interdisciplinary specialists on board, and actually, when I'm referring a patient, I'm always asking my psychologist friend, my psychiatrist friend, after having agreement from the patient, that actually the patient is connected, knows where to go, and actually it's not lost in the system, and the waiting time is vastly diminished. So education, once again, prompts which we use on an everyday basis because of time constraint as well, and some taking home messages. May I have the next slide, please? So a few words. There is a very nice study showing actually the most common conditions in chronic urticaria patients: anxiety, depression, and stress. I will repeat that a few times because this is really crucial. Of course, we can check everything, but you know what I mean. The patient, when asked to fill in different questionnaires, we should not overdo, because too much is too much. So actually, having information is crucial, but also we need time to take care of this information and then proceed with all the interactions. May I have the next slide, please? So psychological comorbidities. There is a very nice study, interdisciplinary one, as a multi-center cross-sectional study on psychological distress. And almost 300 Lebanese people were included. And I just want to say that Dermatology Life Quality Index is one of the most commonly used to evaluate quality of life of the people. And actually, it's used so ubiquitously everywhere that it actually allows for comparison. Definitely, quality of life of urticaria patients, and already Arto said as regards her personal experience, and I am very grateful to, showed you how enormously disturbed it is. May I have the next slide, please? So meta-analysis. Another study which shows us actually perform in a meta-analysis regime, that once again, depression and anxiety are on the top of problems. May I have the next slide, please? And then we are coming to sleep. You know, and actually it's extremely important to ask patients about sleep. Sleep and problems with sleep, either waking up in the middle of the night or waking up very early and have problems with sleeping, are among actually the first features if something is going on as regards stress and functioning of the patient. So it's crucial to ask, because sleep is extremely important for the organism to recover, to function. So do not neglect sleep issues. May I have the next slide, please? And I would like to say a few words as regards our new study, and actually our friend Professor Ivan Ojeda from Ecuador was so kind to actually allow me to show this little slide, the introductory slide during this webinar as regards alexithymia. There are new studies, very important. By definition, alexithymia is it means there are cognitive problems as regards feeling and experiencing emotions. And if we have problems with emotions, as Emek already said, we are emotions. We are actually emotional creatures. So we have problems with our functioning. So very nice study already sent for publication, and I keep my fingers crossed and thank also Emek and all the team for including me in that. May I have the next slide, please? And this is actually something, if you would like to look at one only study as regards psychological comorbidities and chronic urticaria patients, I think this is the one, because it was published already in 2019, but the Greek team really put enormous work on that meta-analysis. And this is really the study to look true. 1 in 3 patients have, as regards urticaria, have psychiatric problems, and 1 in 6 suicidal thoughts. May I have the next slide, please? So, to sum up, in order to remember, as regards quality of life, and actually our dearest Marcus Maurer team work published already in 2006, but still in vogue and actually really very on the top. 1 in 2 patients, as regards chronic urticaria, suffers from anxiety, depression, or somatoform disorder. So functioning is deeply disturbed. And once again, Constantino, as you know, 1 out of 3 patients have psychiatric disorder that should be taken care of in order people function. May I have the next slide, please? And then a few info as regards patient-reported outcome measures. What I would suggest, if you have time and your patient have time and wants to get involved, but remember, not overdoing, because it's really, it's better to ask, for example, the patient, how do you feel as regards total being totally satisfied or being totally washed out and actually taking out of the balance. And when you asked from 0 to 10, it's 1 question. It's not much time, but you have the answer of the person who feels that, who actually, you could not feel that, but asking time-consuming stuff, it's not the matter. But still, if we have time, perceived stress scale, it's 10 items. DAS 21, it's my actually favorable one, which we use on an everyday basis because it has depression, anxiety, and stress evaluation. I love coping with stress strategies. So really, it's my, shall I say, focus stuff, because I love active coping and I love positive interpretation. And actually, I repeat myself being an extrovert all the time, that we can cope with everything as far as we don't have eternal stuff. But, once you remember, once you repeat, your brain will catch it finally. At least it happens to me. It's not easy, just like life, but practice, it's advisable. So then quite vastly hospital anxiety and depression scale are used, and in a few studies also used. We prefer DAS 21 because it gets you to the stress stuff apart from anxiety and depression. Of course, quality of life, and very specific questionnaire, QQAL, with 23 questions. It's a mainstay as regards quality of life assessment in urticaria patients. But as regards dermatology life quality index, it has 10 items, and it is used for actually all dermatological disorders. So it allows for comparison. And of course, we should remember that some questionnaires have got license. So some can be evaluated, can be used by physicians, some physicians, not psychiatrists, some by psychologists, and some are self-reported, and the patients could fill them in on their own. May I have the next slide, please? Okay, so what is stress? My favorite stuff, stress. Just a few words only that, we have eustress and distress. Life, it's not possible to live without stress. And but if it's too much stress, too much is too much, and we cannot function. So remember that this is extremely important to ask. And having insight in our emotional life is also very important, because emotions are hormones, and hormones are so strong that actually can make us out of the balance. So taking care of nervous system and emotions, it's crucial. Very often when, in today's health system, patients are highly highly emotional state, health system which has problems with time, with professionals who are also Homo sapiens representatives, so they are not they are actually not resistant to stress and everyday imbalance. Patients could feel not taken care of, and we should remember that we as professionals, we should take care of ourselves in order to help our patients, in order we don't get the pathway that the blind is leading the blind. May I have the next slide, please? Okay, practical approach. Remember about the environmental stresses taking us out of the balance, nervous system as being the most powerful organ in our body, but destigmatizing, not psycho, not crazy, not something which is in a black box. No, it's it's biochemistry. So this psychosomatic approach to the patient and approach to everybody, it's crucial because it's physiology. May I have the next slide, please? So crucial stuff for me as a physician, it's building trustful relation and actually taking care of the patient, not pushing into the, this neuropsycho approach, but just asking, because sometimes people are not yet prepared to share with you this pathway. But destigmatization of psychiatry is crucial. And I am really underlying all the time. Remember, don't send patients to somebody that you don't know, but to psychiatrist or psychologist. It depends, of course, on the state and your communication and your agreement with the patient, with the team that knows what's going on. Because otherwise, it's really still, unfortunately, stigma, despite being physiology. May I have the next slide, please? And DAS-21, my favorite as regards anxiety, depression, anxiety, and stress scale. You've got in numerous languages that 21 questions, items. May I have the next slide, please? Widely available, but remember that questionnaires are not supplementary, are only supplementary to further psychiatric evaluation. May I have the next slide, please? And you've got a clear-cut evaluation of the state, so you can decide later with the patient, discuss things. May I have the next slide, please? And taking home messages, crucial stuff, it's education and care of the patient by medical health provider in the first place, and actually interdisciplinary team cooperation, because, the primary care physicians, the dermatologists, allergists, clinical immunologists, the patients to whom the professionals to whom the patient are coming on the first basis are mainly not psychiatrists, because the patient is not aware that such help could be provided in the first place. And the importance of central nervous and peripheral nervous system approach comes later. And DLQI, Dermatology Life Quality Index, and DAS-21, I would recommend on an everyday basis. Thank you for your kindness, attention, and sorry for some
Dear Anna, thank you for this valuable presentation. So yes, it's important to build trust with our patients. It's a very important topic. And from your presentation, we understand that not only Arzu is feeling that much suffering about urticaria, her quality of life, as she mentioned, she had to choose between the foods. She had to choose, she isolated herself, she canceled all her appointments, and it was so difficult to go to a first day when you're starting a new job with all urticaria all around your body. It was really so difficult, and we see that many of the patients are also experiencing this, and it's a general issue. So thanks so much. So it's my pleasure now to invite Shreya. She will be talking about how to manage these associated comorbid psychiatric conditions and what kind of interventions can help in this mind and body approaches. These are really very popular nowadays, but it's such an important topic, and yes, we need to take it as a whole, mind and body. And now we are hearing from Shreya. Thank